My daughter sent me an article from NPR that talks about COVID-19 and endothelial health. The title of the article is Clots, Strokes, and Rashes. Is COVID-19 a disease of the blood vessels? A link to this article is in the description below. Hi, this video is from Dan Hammer Health. And if you find value in it, then please subscribe to my channel. As more and more research is being done on the COVID-19 virus, one of the areas of focus has been on the lining of the vascular system. This lining is called the endothelium. It's only 1 cell thick, but it actually regulates most of your cardiovascular health. To give you an idea how large this tissue is, there is approximately 60,000 miles to the average vascular system. This includes all your arteries, veins, and capillaries. Lining all of this is the endothelium. If you took it out and laid the endothelium on the ground, it would cover the surface area of a football field. That's a lot of surface volume. Dr. William Lee, who is a vascular biologist and the founder of the Angiogenesis Foundation, compared the endothelium to a freshly resurfaced ice skating rink before a hockey game. Smooth ice that allows the players and puck to glide smoothly. However, the COVID-19 virus has an effect on the endothelium. In Dr. Lee's words, quote, "When the virus damages the inside of the blood vessels and shreds the lining, that's like the ice after a hockey game. You wind up with a situation that is really untenable for blood flow." End of quote. Dr. Lee and his researchers came to this conclusion when they compared the lung tissues of people who died from COVID-19 to those who died from influenza. COVID-19 patients had 9 times as many tiny blood clots when compared to influenza patients. And the endothelial lining of the blood vessels of the lungs were severely injured. A normally functioning endothelium helps to control blood pressure, prevent blood clots, regulate oxidative stress, works with the immune system to fend off pathogens, and facilitates blood clotting when injury occurs. It's the first and last benefits that seem to be in play when the COVID-19 virus takes over. While the precise mechanism is not known, the reaction of the endothelium is high blood pressure and blood clotting even though no injury is present. According to Dr. Gaetano Santolli, a cardiologist and researcher at the Albert Einstein College of Medicine in New York City, quote, "The common denominator in all of these COVID-19 patients is endothelial dysfunction. It's like the virus knows where to go and knows how to attack these cells." End of quote. This process leads to vascular inflammation that goes unchecked. As this inflammation spreads, it causes more and more of the endothelial cells to be affected. This condition is called endothelioitis and is the result of blood clot formation throughout the body. This then starves cells of needed oxygen and promotes even more inflammation. This increased blood clotting is also confirmed in blood tests. For you to properly stop from bleeding to death, the endothelium produces what is called the von Willebrand factor, which is a critical protein needed for proper blood clotting. Blood tests of COVID-19 patients have shown an increase in this protein. And for those who are critically ill, according to Alfred Lee, a hematologist at the Yale Cancer Center, quote, "They are through the roof," end of quote. This increased potential for blood clotting has led to the use of aspirin and other blood thinners to help offset this. It also may explain why patients with cardiovascular risk factors like coronary heart disease and diabetes are at a greater risk since their endothelium is already damaged and inflamed. And this new information also helps to support why nitric oxide therapy is so important to your cardiovascular health. Nitric oxide therapy is all about nourishing the lining of your vascular system to help it optimize its production of a molecule called nitric oxide. The 1998 Nobel Prize in Medicine was awarded to 3 American researchers who discovered how the enzymes of the endothelium convert the amino acid L-arginine into nitric oxide, the master signaling molecule of your cardiovascular system. Nitric oxide has 3 key roles, which may help to offset the COVID-19 damage. First, nitric oxide relaxes the smooth muscle of the vascular wall to dilate the blood vessels for improved blood flow. This helps to maintain normal blood pressure. Second, nitric oxide keeps blood platelet cells from sticking together to reduce the risk for blood clots. Third, nitric oxide helps to initiate repair mechanisms to heal damage done to the endothelial cells. Nitric oxide therapy has been shown to be very effective in helping to reduce the risk for a wide range of cardiovascular health concerns. Maybe nitric oxide therapy will also be helpful in offsetting the damage done to the endothelium from the COVID-19 virus. A recent study in PubMed seems to indicate this possibility. The title of the study is, quote, Implication of Inhaled Nitric Oxide for the Treatment of Critically Ill COVID-19 Patients with Pulmonary Hypertension, end of quote. The link to this study is in the description below. And if you're interested in this topic and want a deeper understanding, then I would recommend the article in Medical News titled, How Could Nitric Oxide Treat Severe COVID-19? A link to this article is in the description below. It is important to understand that this is inhaled nitric oxide, which is different from nitric oxide produced by the vascular system. Currently, I do not know of any studies looking at vascular nitric oxide and COVID-19, but this relationship is discussed in the following article from PubMed titled, quote, COVID-19 accelerates endothelial dysfunction and nitric oxide deficiency, end of quote. Although a newly published study in PubMed titled, quote, COVID-19 is an endothelial disease, implications of nitric oxide, end of quote, seems to indicate that improving nitric oxide levels in the bloodstream help to offset the symptom severity of this disease. Again, the link is in the description below. Hopefully, more research in this area will help provide additional answers to this ongoing health concern regarding COVID-19 and endothelial health. If you would like to get more videos on how to improve your health, then please subscribe to my channel. If you have questions or need to contact me, then here is my contact information. Thanks for watching, and please share this video with others. Together, we can make a major difference in the health of our family and friends.